Good afternoon, everybody. My name is Amchart. I am the CEO of AMSys Blockchain and Cryptocurrency, and I get the honor to be the, the caboose of blockchain talks this afternoon. So after this, it's done. So I'm honored to be here speaking about what we're trying to do. Since it's the end of the day, I wanted to get a little bit more interactive, a little bit more relaxed. I'm more of a conversational kind of guy. So we're going to talk about some basic things. The first thing I want to talk to you about is who we are, why we're doing what we're doing, what's the reasoning behind it, how we're doing it, so you get an overview of what blockchain can do in an electronic health record. We're also going to talk about collaboration, because in this space, in a decentralized space, you want to collaborate with all the main players out there that are trying to change healthcare in the best way possible. So for us, what we developed was what we call it a universal medical record, but in the end, it's an electronic health record that's built on the blockchain. And we'll go into a little bit of the overall view of the technology we're using. But if you want to learn more about the back-end tech, our CTO is here. I can also talk to you about it as well. So when you're here and you see 1,500 different booths, you also start wondering, who are these people? What do they do? And so I want to give you a little introduction to us. AMSys Group is our umbrella company, and under which falls AMSys Blockchain. And we've been around for 15 plus years. The group itself was started by our chairman and CEO, Kim Paddock, who's actually my brother-in-law as well, so we're a family-owned company. We started it with $200 in our pocket, and today we are wildly successful. We're a debt-free company, $100 million. And so when we became successful, we decided, what do we do with technology? Our goal with technology now is since we can do whatever we want to impact different areas and lives and for people. And healthcare is a sweet spot for me. And so since I'm in that division, we decided to tackle one of the biggest problems in healthcare, which is the movement of data, how to access data on electronic health record, and to be able to utilize it for proactive healthcare management. So now it doesn't work. All right, well, there we go. All right, so who we are, AMSys Group, and there's our website there. Those are all the divisions that we run at AMSys Group. So we started off in IT and managed services. We do hardware, software development. We actually develop the back-end tech for 4 or 5 other companies who want to get on the blockchain. So if you have ideas that are difficult to get on, or you want to know how to do it, we provide the consulting and the ideas to do that. We also have a full blockchain division, and we do other areas as well. So in 2010, I started the healthcare division under AMSys, where we were helping doctors' offices deal with the pain points that they have: revenue cycle management, medical billing, transcription, insurance verification. But the biggest issues that we found was the sharing of data, either provider to provider, provider to hospital, or even patient access. And so we tried to work on a medical record back then, but the barrier of entry was high and technology wasn't available, and it was expensive to deal with other legacy systems. But over the last couple of years, blockchain technology has lowered the barrier of entry and has allowed a lot of different companies to enter that space to try their hand at trying to make changes to healthcare data. So what is Amchart? All right, Amchart in itself, this is going to be just kind of a basic overview, but Amchart is designed to be patient-centric, it's designed to be provider-friendly, and proactive in its nature by using AI and machine learning. All right, our main objective is for patients to have control of their data. The data belongs to each and every one of you. You should have access to it whenever you want. You should also have access to do with it whatever you want, to earn off of it, to be incentivized for it, and to use it for the purpose what it needs to be, to change your own health. Right? So we also look at Amchart as the basis of a platform for collaboration with other healthcare blockchain companies or other companies who want to get into the space but want to create a healthy ecosystem. Right? So since we're being a little interactive, I'm going to ask a question. Not everybody is in the US healthcare system that's here. How many of you filled out a paperwork at a doctor's office, yet were referred to somebody else and filled out the paperwork again? Raise your hand. Raise your hand. I've actually done it in the same day, been referred to, right? That should never happen. We live in a society that we should be able to have one-time registration and never have to deal with it again, and blockchain tech can allow for that, right? So then why? Why do I want to do Amchart? Come on now. There we go. So we find different pain points, and these are the things that a lot of providers have told us, all right? That current systems are fractured. They have difficulty with interoperability between legacy systems, all right? Imagine trying to move from one large EMR to another. It's sometimes wildly difficult, all right? Data is always kept in silos by payers, by health companies, by EHR companies, because they use it for their own purposes and for in data brokering, right? That should not happen because patients should have access to that. Portability of records. I mean, there are plenty of us, I included, who have taken my children from one pediatric doctor to another, and it takes weeks to get that medical data over to them, all right? And so those are the issues that blockchain and interoperability issues that can be solved in that regards. Limited timely access. I have a lot of friends who work in the ER or in urgent care. And sometimes I have patients that come in that they don't know what medications they're on. And their care becomes more conservative because they don't want to give them a medication that could counteract something they're doing. Or give them an intervention that could cause, let's use an example. If a person is on a blood thinner, they don't want to do a surgical intervention if they don't know if that patient's on it or how long have they been off of it. So anytime you have timely access to data or regular data, you can actually make better clinical decisions. And of course, what we want to try to do is incentivize people for the use of their data, right? And most systems don't allow for that. So that's where our features come into play. So those are the issues. This are the features that we've developed. We wanted to create a secure, HIPAA-compliant, hybrid blockchain model. I'll explain what that is. It's patient-centric. Patients are always at the center of this. We do incentive-based health and wellness programs, and I'll show you a few screenshots from what we're trying to do. Improve portability and improve consolidation of records, and be able to access records from other legacy systems which we're working on. So in a brief overview, how does Amchart work, all right? Amchart has two parts of it. So there's a hybrid model. So we use an ERC20 token. We're using an Ethereum token to get timed access to your medical record, but also it's used for incentives for the health and wellness program. Now, we don't believe public blockchains can actually support having full patient data on there. One, it's slow, it's expensive, it doesn't scale. So all of our data is divided. So we divide data into de-identified data, which sits on a Hyperledger Sawtooth framework, and our identified data right now is going to be sitting on a HIPAA-compliant cloud. It doesn't mean we're not also exploring public blockchains. In fact, we are. We feel like that you have to start from a private, go to permissioned, and then eventually end up on public. But the public can't support it just yet. So we're proving the concept that this can work, and then moving forward. So as our development has progressed, we're in kind of a 4-phase development cycle. The first one is the MVP of the electronic health record itself, which is actually running on the test net, and we're planning on allowing for public consumption or trial of it in the next couple of months. The other thing we worked on was a mobile application. Now, our mobile application is going to allow for IoT device integration, which we've already done. So you can take things from your Fitbit, your Apple Watch, blood pressure monitors, ECG, pulse ox. All that data not only goes into the mobile application, but automatically gets ported in the electronic health record. So when doctors open up that record, they see live data. They don't see old data or data that's coming in weeks later. They see what you've been working on. In fact, our mobile app will also have things like food intake. It'll also have things like steps. So your doctor will know whether you've been doing certain things or not, right? And the third part of it is building out our AI platform. We want to be proactive. As we get data such as lab work, blood work, diagnostics, and start doing our machine learning and AI algorithms, we want to be able to be predictive in future healthcare issues before they happen. So as far as where we are in development, like I mentioned, our MVP is up and running. We're just finishing up a few odds and ends, and in the next month or so we'll be able to release it. So if you sign up with us, we'll give you first access to that record. Our mobile application is going to be released on the Apple Store right at the first week of April. We're hoping for an April 1st launch so that you guys can actually test around with it, move data off and on, and be able to actually get it into the electronic health record itself. So let's do another poll. Let's talk for a second. Can you take your data with you? How many? Well, everybody has their cell phone on them. Raise your hand if you have your cell phone with you. All right, everybody has their cell phone. Some people are there. How many of you can access your bank account right now on your cell phone? If you just needed to check your balance, most everybody can. Some people can access their brokerage. How many of you can actually access your electronic health record right now on your cell phone? A few can. There's some things out there. A few can. But there are more people that can access their bank account than the most vital data they own, which is their healthcare data. And that should be the same as your bank account to us. Now, the other thing is, these are just more rhetorical questions, but there's a lot of people wear Fitbits and Apple Watches, but most of that data doesn't go into your electronic health record. We feel like that should also go there. We also feel like that when there's things out of parameters based on IoT integration, you should be able to be warned through your mobile app. You should be able to have video visits or HIPAA compliant chat when things go out of parameter. And that's what we're developing currently. So we talked earlier about the ability to do one-time registration. So we're already, I'm showing you just some screenshots, we're doing one-time registration. And then this registration can always be updated, but we also have HIPAA forms. We're gonna have informed consent, be able to do those one time. And so then when you move to a different platform or you're seeing another provider, all that data is available to them based on your permissioned access. Now, as far as mobile apps, these are screenshots from our mobile apps. We've already done IoT integration, but we're also showing you that you can do progress goals. If you maintain certain blood pressure regimens, medication adherence, compliance, we can track those in there. If they're out of parameters, it'll alert your physician. Same thing with blood pressure or your calorie intake. Maybe it's really high. It again can alert your physician. Our goal is if you can have better interaction with your primary doctors and you're utilizing secondary or higher level care less, then payers, providers, and even patients all benefit from that. So we're also going to be doing data monitoring. Hang on. So we're going to be tracking blood sugar and blood pressure over time. These things can be integrated into our AI and ML platforms to be able to be monitored or be able to give you better insight into your own health. We're going to have clinician monitoring. So currently the app is being tested in a small hospital in Spain, and what they're utilizing it for is for post-operative care. You know, let's say, for example, they utilize it for orthopedic, like total knee replacement. Are they doing their exercises regularly? Are they getting on their CPM? Are they actually taking their medications on a regular basis and doing their vitals? And if it's not, it alerts the physician. So what we're doing is we're creating patient and provider accountability, but we're also incentivizing people to do that. Can you actually gain financially from your own health? Well, currently, you're not, all right? Your data is brokered on a regular basis without your well, some of you know it's being brokered, but some of you don't know it's being brokered. It's being used for different kinds of research. But you should own your data, and you should be gaining financially from those things. And so we created kind of an ecosystem the way we look at it. Patients are always going to be at the center. And so how we incentivize patients with our ERC20 token is simple. Build a medical record in our platform. You're incentivized with tokens. You decide to maintain vital signs or progress goals. Again, you're incentivized with tokens. You give permission to access your data for pharmaceutical research, clinical trial matching, for other research institutions. Again, you get incentivized in tokens. Now, a lot of times we talk about crypto, the crypto and blockchain get mixed together, right? And so crypto is a bad buzzword. But our goal is for people to be able to utilize their token value for other things as well. Change it over. Go move that token value into gift cards or airline miles or do some shopping. Whatever you want to do, we want to be able to incentivize you in all different ways through redemption programs so that you, when you're proactive with your own health, can also do something about it and reward yourself. All right, and there's a lot of other things we can tell as far as providers and payers, as far as, you know, when we're keeping people out of the hospital and urgent care loop, and that's taking the stress off of payers, they'll see a decreased amount of utilization of those high-end services. They can then pass along those savings to their membership. They can lower premiums. They can also increase reimbursement for their physicians. And we've talked to several self-insured companies who see that as a good view of being able to use our network and our platform to be able to do those things. Now, my other thing with it is, do you feel that new technologies can solve the current state of EHR issues? All right? Because when you walk around here, there are a lot of electronic health records or EMRs out there. And so why do we want to tackle this? We feel like that the way electronic medical records and the data is being utilized right now is unfair to the patient, but it's also unfair to providers and payers as well. We feel like when there's a healthy ecosystem of companies that work together, especially in the blockchain space, you can make drastic changes to the way healthcare data is utilized and how population health can be managed. See, our goal for this electronic health record is to attack 3 areas of population health that easily can be, I would say, manipulated but managed, which is obesity, diabetes, and hypertension. Because if we can increase compliance and adherence to certain programs, if we can increase incentives to patients, we can actually have them change their behaviors. Some people are motivated by what we call extrinsic motivation factors, right? If I get rewarded, I'm going to change my behavior. And some people like intrinsic, motivation, which is I'm doing something for my own health because I want to see the change happen. Our goal is can we combine those two to provide some change through the intrinsic model and use token-based incentives for the extrinsic values, and that's what we're trying to do. But we also feel like we can't do this alone. We want to create a healthy blockchain ecosystem. And if you look at that diagram, we put collaborators all over because that's what we want to do. But under each one of those, you'll see things like medical reconciliation, genomic data integration, identity management, radiology, self-insured companies who are actually that are doing every little piece of this on the blockchain right now. Some are out there in the public, some are here, some are out in other spaces. But we feel like that if we become an ecosystem where we can create a medical record and then we become kind of the knights of the round table where everybody sits around and does their job really well, we can create the ability to actually change healthcare and use data for its purposes. So our goal at Amchart is this. One, we're going to create the electronic health record and the incentive programs. Two, what we're going to do is we're going to go out and find those blockchain companies that are doing things well. And we're going to partner with them and be part of the network with them. Then three, we're going to create a shared data model where they have access to data, permission data, we have access to their data, and we create healthy ecosystem models for different kinds of healthcare initiatives, whether it's cancer, whether it's obesity, whether it's diabetes. We feel like that if we can make a change in any of those things by percentage points, then we have done our job. Our goal here is not to use the electronic health record and all the data for our financial gain. We actually want to give this platform to the people. We also want to give the ecosystem to the people, and we want to pass through all that data brokering dollars as much as we can to the people so that you own your data and you get to do whatever you want to do with it. So the goal, like I said, is for all our companies to be on a shared collaborative data model. All right, we want to give each other access. Share data for clinical trial matching. Share data for research purposes, predictive future analytics, improve patient health. That's what we're after, right? So if we have an ecosystem of trusted partners and each one of us is doing our job fantastically well, and then we're able to then be able to change certain dynamics and certain healthcare issues, then we have done our job. Right? So with that being said, there's all my information. That's my personal cell phone number. That's my personal email address. There's our website. If you have interest and you're in the blockchain space and you want to collaborate and be part of an ecosystem or at least share ideas, love to talk to you about it. If you feel like that your company or organization wants to build themselves on the blockchain but don't know how, we'll be more than happy to give you a consult on what kind of technologies are out there available for you to do that. And if you want to be involved in some of our pilot programs, we're working with community clinics at the end of the summer to actually have our EMR running in their facilities with 4,000 or 5,000 patients. We'd love to be able to have you, give you a free pilot of our system in your networks. We'd be happy to do that as well. So thank you for having me. I don't know how much time I have. There's about 18 minutes, one minutes left. So if anybody has a question, I'm more than happy to answer it if I can. If you have a question, I'm going to divert you to my CTO. I'll tell you that right now. All right. So are there any questions? Yes. Our plan to get integrated with certain EHRs. We're developing API. We're developing HL7 integration.
Token value briefly on how that's going to empower patients to actually monetize their data.
Yes.
Could you go briefly into how that works on exchange and how that can be facilitated?
Well, exchange stuff is very difficult. So let's use an example of how we imagine doing it. So imagine if we have your data and our AI engine can match you to a clinical trial. Well, let's say a typical clinical trial pays you $1,000, right? If you're involved in it. So our goal through our mobile app is we're going to incentivize you to maintain adherence all throughout a clinical trial, because a lot of times that happens is dropout is a big issue with clinical trials, right? So if we can get them in, we use the mobile app to alert them on, hey, you have an appointment coming up, you're doing that, and you're going to receive $1,000. They may receive 98% of it. We keep 2% of the fee. The rest of it goes into a one-on-one token value. So if it's $1 value, they get, let's say, 1,000 tokens, and then they can do whatever they want to utilize with it. As far as exchange value goes, it's tough for me to talk about that, just because exchange value can vary. So our goal right now is to tie it, what people say is a store of value more than anything else, is what it's going to end up being. There's only going to be a certain amount of tokens that are in the circulating supply. So as those tokens get less, then you're going to see the value go up. And so we're going to have an algorithm which kind of, in essence, evens out the value, so it kind of stays at a very steady level at all times, is what we're trying to do. And it's difficult right now, so we're still working out the metrics on that. And with that being said, I'm done. So if you have any other questions, please come by, talk to me. If you want to learn more about other companies that are in the space, I'd be more than happy to introduce you, like people like Heather Frannery, who's doing obesity PPM. They have a great company. There's others as well too. See, I'll give you a shout out, girl. Why not? All right. So if you have anything else, please come by and talk to me. All right. Thank you.